Next up, we have a terrific announcement for an amazing leader in healthcare delivery, bringing digital to healthcare delivery in Bangladesh, who announced a wonderful round closing a couple of weeks ago. And we've worked with her for a number of years through the HitLab office in India and South Asia. And Sylvana, welcome to the program. How are you doing?
I'm well, thank you. Really excited to see you. How have you been, Stan? Good to see you after a long time.
I know it's been too long. And where are you sheltering?
I am in New York City at the moment, but I'm heading back to Dhaka, Bangladesh on Saturday.
Wonderful. And give everyone the big news in case they haven't read about it. Tell us about your round.
Yes, so we just closed a round of funding, which brings our total amount raised to date to 10.6 million. And it's really, been amazing to see the response we've actually gotten to the announcement. We've never announced before how much money we've raised, which perhaps is a gender issue that I don't know if that's why I've always been really reticent to share that kind of detail about the company. But I think it's a lesson for me that I should have made those types of announcements earlier on, to be honest, because I think it's really important for the ecosystem. We face so many challenges across emerging markets, I think, to attract capital and for people to really understand that there are sustainable business models to be built around healthcare service delivery. And for Bangladesh, I think it's one of the largest amount that any startups actually raised in the market. So yeah, really, really excited to share that news. And thank you for your help in spreading the word.
Well, I think your presentation on CNBC got the word out nicely, and you've been all over the world. But tell everyone about the company and for folks that don't know about what you do.
Yes, no, thank you so much. So just to give all of you the context, Bangladesh is the eighth most populous country in the world. A lot of people don't realize that there are 170 million people who live there. And the population density is actually even 3 times that of India. And it's one of the fastest growing economies in the world, even against the backdrop of the recession last year. It grew 4%. And before that, it had grown 8% in 2019. And so, despite all of this incredible progress, the large market, and all this growth, the healthcare system is still facing a lot of challenges. The average doctor's consultation is actually 48 seconds. There's only one internationally accredited lab in the country, and a lot of the drugs in the market are counterfeit, 10 to 15% by some estimates. Beyond that, there's a huge gap in terms of quality. And as is true across many low and middle income countries, more people are actually dying due to lack of access to quality than lack of access alone, which is very surprising to many. So I started the company we started serving patients in 2018. I started working on this problem in 2014, actually. Spent a lot of time really digging in and trying to understand the problem and what I could do. And, around that time, everyone was really obsessed with Uber of blank, right? And people asked me, why don't you just start Uber of, for healthcare in Bangladesh? But when you don't have the underlying infrastructure, all you're doing then is contributing to the problem and increasing access to poor quality services. So it was very important to me to invest in and really build that infrastructure, which has taken time. So basically what we're doing is we've built an integrated outpatient care model. We're a patient-centric company that aims to be every patient's first call, whether that's in clinic or from your phone, from anywhere. We offer any of the outpatient services that you require. That starts with your first call on your phone for a telemedicine visit. It includes e-pharmacy as well. It includes in-clinic services. So we have a 10-story building in downtown Dhaka, which is the capital of Bangladesh. Which includes, family health services, family health, women's health, pediatrics, dentistry, ophthalmology, as well as outpatient specialties like cardiology, gastroenterology. We do the full range of testing in-house, including COVID testing. Actually, we're very busy. We were the first private lab to get approved to do COVID testing last May. Full range of imaging services in-house and full range of pharmacy services in-house. And we've launched the first patient app in the country as well. So a full range of services, really. We've served 150,000 patients to date.
That is impressive. That's so impressive. And tell us a little bit about how a virtual first healthcare is affecting patients in Bangladesh, and how Praava Health, your platform, is helping respond to that need.
It's really interesting. I think because of the quality issue that I shared, there was a really strong resistance to accessing care virtually in Bangladesh for good reason. There were a lot of people who were doubtful that, okay, if I get on the phone or get on a video with somebody, how do I know that they're an accredited doctor? How do I know that the drugs I order online are, going to be delivered to my home, that they're going to be not counterfeit? And I think that that has actually worked in our advantage because we had built the infrastructure and had started building a brand that was equated to quality. And so when we rolled out digital services exactly a year ago. We rolled out telemedicine actually in end of March 2020, and we rolled out e-pharma in early May. I think it helped us to really scale up, and we're now actually one of the biggest players in both telemedicine and e-pharma in the country because of the fact that I think people felt, okay, I know this is a real healthcare facility. I know there are real doctors and real pharmacists who work there, and I can really trust the care that I'm accessing. But I will say it's definitely tapered off since that peak that we saw May, June. We saw really high access rates of telemedicine. Patients are still preferring to see their doctors in person. We are trying to discourage them from doing that even now. We're experiencing a surge across South Asia in terms of COVID cases right now. And so, as we did a year ago, we shifted 90% of in clinic visits to virtual. We're doing that again. I think patients are getting used to it. But there's definitely, because of the trust factor, there's definitely some resistance to that. I think it's going to take time for patients to really continue to adapt. But what we've seen globally is very similar to the experience we've seen in Bangladesh, and I think it's going to stick.
That is impressive. And so talk to us a little bit about the Praava platform and how it's both novel and relevant in these days, in this age. And I'm sure what's going to be happening globally is this new endemic kind of super flu season that's going to hit each year, and how the Praava platform, what kind of solutions specifically it's going to bring to patients and physicians.
Absolutely. So, we are an outpatient provider. And when COVID first hit in a country like Bangladesh, which lacks the number of ventilators required to serve really acute patients for COVID, we were approached by a lot of organizations. Oh, can we set up ventilators in your facility? Can we do this? Can we set up an ICU? And we didn't want to do that. We said, we're an outpatient provider. We've introduced value based care concepts to the delivery of care for the first time in the region. We're focused on keeping people out of the hospital. So, how can we apply that to COVID? So, we built a tool actually for remote management of COVID. And nationally in Bangladesh, it's a very hospital centric system. Anything goes wrong, people show up at the hospital right away. Nationally, COVID positive patients are being hospitalized at a rate of around 50%, which is not necessary and a bit absurd, right? And so we built a tool for remote management where patients can communicate by Facebook Messenger. Actually, once they test positive, they get put into a risk profile and they get asked to self-report biometrics depending on what their risk profile is. That gets fed into a system that's got an AI and machine learning layer to it that then, analyzes that, feeds it to a remote medical team. And the doctors, if they think necessary, they will say, all right, I've got to talk to this patient. I've got to do a video consult, or I've got to tell them to go to the hospital immediately. And through that tool, we were really able to raise awareness, educate patients and loved ones on how to take care of each other, during this time. We reduced hospitalization rates to 14%. So we're really excited about this tool. We think it has future applications to chronic disease. You mentioned flu season. So what we're focused on right now is really trying to build out that virtual primary care piece so that we can apply the same logic to managing other chronic conditions and even things as simple as the flu.
That's incredible. And partnerships. What we've noticed is how important partnerships are in rapidly accelerating models now in digital health. Talk a little bit about some of the partnerships you touched upon it lightly a few minutes ago that you've developed at Bangladesh and internationally and globally. Because I've known you for a long time now.
Yeah.
You are just on top of just being brilliant. You're also really good at understanding the macro economics and the macro politics of digital health and of healthcare globally. You brought in a lot of folks from around the world to help out with this platform, Bangladesh. Talk about the partnership aspect and how you've been able to bring those to actually bear fruit in your growth.
Thank you so much. You're very generous and very, very kind. I really appreciate those words. So our chief technology and product officer actually comes from a pure digital health background. He has a really interesting story. CTO for Telenor Health, which is Telenor, one of the largest mobile companies in the world. They're a big bet on healthcare, and it was started in Bangladesh, actually. He's a Sri Lankan Brit by background, born and raised in the UK, moved to Bangladesh with his wife and his son. And they were actually, he and his wife got pregnant. They had such terrible experiences in the healthcare system in Bangladesh. They were about to leave the country, and someone suggested they come to Praava. So he originally came to Praava as a patient, actually. And he and his wife had such a wonderful experience. He actually found a way to connect with me, and we became friends, and he became an advisor to the company. Then he joined us as a chief technology and product officer. I think the really interesting thing that I will share about his perspective and what you're seeing across digital health is digital health alone can't be the solution. And what he experienced at Telenor Health and in other similar businesses, Babylon has a very similar story, is that they ended up not being able to retain about 20 to 30% of patients. They were losing those patients to physical infrastructure because at some point, you and I could never go to a pharmacy for the rest of our lives. E-pharma, fine, that business is a wonderful one that can be purely digital. Healthcare, we're going to have to see a doctor someday. And so what I'm really excited about with our model is by observing these examples like Babylon, like Telenor in Bangladesh, and even when you look at models like One Medical and Forward in the United States, is really being able to combine this, what we call brick and click, right? Combine the brick and mortar with the technology. That's what we've really learned. And, there's incredible work happening. Oscar has done some really amazing work to be able to predict, ER hospitalization rates. And, the head of clinical innovations over there is one of our advisors, actually. So we are trying to learn from these innovations that are happening all over the world and bring those tools to Bangladesh because they're affordable and they can really help us to improve outcomes.
Yeah, that's incredible. That's absolutely incredible. And tell us, where is Praava Health going to be? We've got a few more minutes. Where's Praava Health going to be in 5 years, and what are you envisioning there?
Oh, I have big dreams. I'm trying to build the best healthcare company in Bangladesh and even beyond. I think that I'd like to really spend the near term. We've got 170 million people in Bangladesh. I'm really focused on Bangladesh. But as we scale up our technologies, I really do think there are elements of what we're working on, in particular on the kind of doctor's portal and clinical decision-making side of things and the virtual primary care side of things. Those pieces can definitely be scaled beyond the country. But I also think this concept of brick and click can be very compelling. And when you look at different components of our business model, our margins are actually much better because we've combined all the elements. And we get to own the labs, we get to own the margins on those kind of high value products. So from a business perspective, I think that this can definitely be scaled beyond Bangladesh. So who knows? But we're really focused on the 170 million people we have at home right now.
Yeah, and that's a big task, obviously. And then we know, again, the research work that we do at the lab and certainly globally is clear that digital health has a place all around the world, but it looks different in countries like Bangladesh. There's
Right.
a different ecosystem of digital for people to tie into. Flip
Absolutely.
phones,
I was just actually, sorry to interrupt you. I was just on a Clubhouse earlier today. There's a Clubhouse at 8:30 Eastern time on digital health that features a lot of leaders in Asia. And one of the things we were talking about is that there are so many of the digital health innovations that exist were developed in the United States, and they are not scalable across 80% of the world because they're not affordable. And so I think that's one of the things I'm really excited about is developing tools like the one we've built, which you can just use with Facebook Messenger, right? Which doesn't really cost anything. You do have to have a smartphone or a feature phone, but beyond that, it doesn't require connection to a device or anything like that. I think we need to see more innovation in these areas.
That was fantastic. Well, wonderful. And how would you like to wrap up? We've got a couple more minutes. Any last messages that you'd like to give to the audience?
No, thank you. I'm just really excited to be here. I didn't catch the whole session, but I joined a little early, and I really appreciate the comments that Priscilla made in particular. That we need more women in leadership in healthcare, not just in women's tech, not just in women's health tech. Women are 65% of the healthcare workforces in the world. Women are the ones usually accessing healthcare on behalf of ourselves and our families. And so I just would really strongly encourage all of you to consider taking up roles in leadership because we need our voices to be heard.
Yeah, without a doubt. And when do you start raising your next round? Just so
I'm already doing it. So if anybody wants to talk to me about our Series B, feel free to reach out. Thanks. It's a great question.
All right. Thanks, Sylvana. Take care.
Thank you.